Hello and welcome to Total Health with Dr. Nick, where my purpose is to inspire, empower, and motivate you to live longer, healthier, and more abundant lives. And today I've got a great video for you because this is something I have to tell you I am really, really excited about, and that is regenerative medicine. And why am I excited about that? Because I know so many of you are struggling, you're suffering, you're living with chronic pain right now that you're looking for answers. Maybe you're crying out to God in pain saying, give me some answers to this. Well, hopefully I can provide that for you, because regenerative medicine is what I believe to be really the health of the future. Integrative healthcare, where you're combining all the great therapies and aspects of health into one location, but at the same time, regenerative medicine, where you're talking about stem cells. That is just cutting edge science, and I love it because we get to help people not suffer any longer. And if you're suffering, comment down below. Let me know if you're sick, you're suffering, if you're having struggles and trouble. I'm here to help you out. I hope that you take this information and it touches your heart and you are able to find the answers that you're looking for. But like I said, when it comes to things like regenerative medicine and the regenerative medicine revolution, actually being able to live pain-free, I know for some of you it seems really far-fetched. It seems like there's no way that that can happen. So hopefully I can bring some inspiration to you with this. But things like stem cells, I know you've heard a lot of things about it. Maybe you've heard of the miracles that have happened with stem cells, and maybe you've heard such not good things. Well, I'm here to set the record straight for you today and really let you know what it's all about, how they work, where do you find them, what's the best sources of them. And I promise if you watch to the end, you're going to learn exactly how to find the best doctor in your area, okay? So guys, if you're struggling with shoulder problems, if you're struggling with knee problems, elbow, tennis elbow, golf, you want to get out there and golf again and you can't because you have a hip problem or low back, or maybe your neck is an issue, or maybe you have, like I said, tennis elbow and you can't play anymore, or your shoulder's so locked up. I'll tell you what, some of the worst patients I've seen are ones who have had shoulder surgeries. They're never really the same after that. So hopefully, like I said, we'll give you some answers to that. So let's go ahead and dive on in. Guys, make sure if you like what we're talking about, that you like, you share, you comment, and subscribe. Make sure you click that little bell notification so you get notified anytime I do a video. So let's go ahead and get started with the regenerative health revolution. So what I want to talk about first is, why do we need a regenerative health revolution? Well, guys, I think you know the answer to that, because we tend to throw drugs at every single problem. And I know we tend to say in our office, there's a pill for every ill. And guys, we see it all the time. People are just literally bombarded with drugs. We're not doing things right. We're trying to do everything we can to be healthy and well, but yet we're getting sicker and sicker as a society. And I can tell you, in the United States alone, and I don't know what it's like in your country, but 1/3 of all Americans are going to die of heart disease. Another third are going to die of cancer. And if you think, well, I hope I'm the other third, well, the other third is going to die of the Alzheimer's, the diabetes, the obesity, and all the other degenerative diseases that, I'm sorry to say, if you live in the United States right now, which is where I live, 1 out of 1,000 of you will make it to 60 and in good health. And I don't mean 60 and breathing. I mean 60 with a quality of life that you are enjoying your life, that if you want to go to the park with your grandkids and play, and you want to go on hikes, and you want to travel, and you want to open up your new business, whatever it may be, you can't do it because you don't have your health. Your health is your greatest asset, and you don't have it because maybe you've been just throwing drugs at it this whole time. And I'll tell you what, it's not much better with our children. Our children are getting sicker and sicker. In fact, we're seeing kids today getting adult onset diabetes. In fact, they don't even call it that anymore. It's now called type 2 diabetes because kids are getting it. Kids are being put on cholesterol-lowering drugs as low as 8 years old. We're seeing kids with more asthma, more allergies, more autism than ever before. Autism, when I was a kid, it was maybe 1 in 10,000. Now it's about 1 in 48. So this is something that we are definitely doing wrong. Our kids are getting sicker. We're throwing, like I said, more drugs, more surgeries, more hospitalizations, more testing, more everything, and yet we're not getting healthier as a society. In fact, they're saying this is the first generation of children that will not outlive their parents. So we need to do a lot of things differently. Guys, we're doing things wrong. Now, I'm not saying that you don't need drugs, you don't need medications, because sometimes you do. In fact, in our office, we are a regenerative medicine center. So we have medical procedures in our office. We have a medical doctor. We have a nurse practitioner on staff. So we do some medical procedures, but they're typically and always regenerative. And why? Because we're seeing too many problems with drugs today. We're seeing an opioid crisis. You all know about it. That is an epidemic proportion. So everything we do is to keep people off of drugs, off of medications, because they're dangerous. So an article was written in Discover magazine where they found this, that American healthcare is among the worst in the industrialized world. They said, according to our healthcare system, we rank 37 in the World Health Organization, that by any measure, longevity, infant mortality, and burden of disease, we sit in the basement of the industrialized world. That's right. We have more doctors, more hospitals, more staff, more testing, more everything, and yet we're not getting healthier. That's why regenerative medicine needs to be the answer to your healthcare problems. Barbara Starfield did a report where she asked, is American, once again, the best healthcare in the world? And what she found was this. She said 225,000 deaths occur every year in the United States as a result of the medical profession. Now, once again, I'm not telling you not to go to your doctors, because your doctors are the best in the world at life-saving techniques, things like crisis, emergency, and trauma, but they're not the best when it comes to healthcare. We have to get out of this model. This philosophy is really what it is. It's a philosophy of throwing drugs and treating disease just by putting more chemicals into our bodies. I always say we're not sick because we need more chemicals. We need better function. We need a better functioning body, not more chemicals. Study was done comparing the longevity versus how much dollars were spent on healthcare around the world. Look at all the other countries of the world here compared to the United States. So we put more money into healthcare than any other country in the world, more than double the next closest country, which is Germany, and yet we have less to show for it than other developed countries. Our longevity rate has been going down steadily over the past couple of years. And according to this article in Washington Post, it says, mistakes involving medication sicken or kill at least 1.5 million Americans every year. Guys, that's more than, 3 9/11s a day happening. Now, like I said before, I'm not telling you this so you don't go to your doctors. We absolutely need doctors. Sometimes you need your surgery. Sometimes you need your life-saving medications, and I get that. But we need to start rethinking how we're taking care of our bodies, because we're not getting any healthier. We're getting sicker and we're getting addicted. And think about this too. How many times do you see someone who's on a lot of different medications? As they get older, they tend to be on 5, 10, 15 different medications, and they're not the healthiest person around. If drugs made us healthy, the people on the most drugs would be the healthiest people. But instead, we know it's the exact opposite. The sickest people are on the most drugs. So once again, we need to be getting off of drugs and get our bodies to function better. One of the biggest issues we see today is the opioid crisis. It turns out that 80% of all the opioids consumed are consumed right here in the United States, and that the #1 most common diagnosis associated with opioid drugs is back pain. Now, not only that, someone dies from an opioid overdose every 15 minutes. We hear about this all the time. And guys, once you get to a point where you're addicted to these opioids, your doctor's going to cut you off. Once your doctor cuts you off, what tends to happen? And I hear this all the time. People say to me, Dr. Nick, I don't know why people end up using heroin. Well, they use heroin because they're in chronic pain. They don't know what to do. They can't handle the pain anymore. So instead of going to their doctor who's going to cut them off, and not to mention these OxyContin drugs are so expensive, they end up getting their drugs on the streets. It's a whole lot cheaper. And guess what? The drug dealer is not going to cut you off. He's going to keep you coming back for more, and I understand that. That's why we need to be treating your pain and treating your discomfort, your shoulder pain, your neck pain, your low back pain differently, and that's what I hope to provide for you is really good information today as to how to do that using regenerative medicine and stem cell therapy. When it comes to the amount of people dying from prescription drugs, the United States tops the list. 245.8 people per million are dying of prescription drugs. Okay? So look at the stats to the rest of the world. United States is in overload right now. And once again, we consume over 80% of the world's pharmaceuticals, yet we have the sickest population. We have the lowest longevity. We rank first in a lot of things like depression, which I'm sad to say, but we need to be first when it comes to overall health. And this proves to you just how much more we need regenerative medicine. So now the regenerative medicine model. Now we're going to get into the good stuff, so I hope you stuck with me here. The regenerative medicine model is really the way to go. We combine in our office many different aspects of integrative health. So we've got, like I said, regenerative medicine in the form of an MD and a nurse practitioner. We also offer in my office chiropractic care. Why? Because we understand the brain and the spinal cord are the body's ultimate healing system. All healing starts with the brain, travels down your spinal cord through the nerves to all the parts. So every single cell, tissue, and organ in your body has to receive mental impulses from your brain. So that is the fuse panel for your whole body. So we literally think of the spinal cord and nerve system as the fuse panel, just like you would have in your house. We then combine it with genomic testing, so we could take a DNA sample of the inside of your cheek, send the results off to the lab, get the results back, put it into a report, and we're able to give people epigenetic information, which means genetic information on their diet, their exercise, their sleep patterns, their toxicity, hormones, anything you can imagine. We can be able to tell you exactly how you should be eating, your nutrition, your supplementation, so that your genes are expressed at optimal levels. We also do neurofeedback in our office, where we work with brain-based disorders, nutrition, weight loss, rehabilitation, and functional medicine. All these different things combined together are able to give the patients the best outcome. So what kind of conditions are you struggling and suffering with that could be helped with stem cell therapy? Well, think of things like rotator cuff injuries, shoulder problems. Like I said before, one of the worst injuries you have to recover from, and I see patients all the time coming in with this. They'll fall on the ice, they'll separate their shoulder, they'll fall playing with their kids, roller skating, rollerblading, whatever it may be, just maybe doing yard work, and they injure their shoulder, and next thing you know, they're headed for a shoulder surgery. And I could tell you, you would rather have your hip replaced than deal with a shoulder surgery, because it's so hard to rehabilitate. It's such a joint, an important joint that you use on an every single day basis. But rotator cuff injuries, bicep tendon tears, things like joint degeneration can all be helped by stem cell therapy. Arthritis in your wrist, sprains and strains and tendonitis. I see patients a lot coming in because they do things where they're working with their hands all the time. Maybe it's their job, maybe it's something that they injured as a kid. They fell down on their wrist. They fell off a horse. A lot of people in my area horseback ride, a lot of different horse competitions, and people fall all the time. Injure a wrist, injure an elbow, injure a shoulder. All could be helped. Things like knee problems, osteoarthritis. I have a lot of patients in my area that are golfers, that are tennis players, that are runners. They're running all over the place, and they all have tendon knee issues. They might have degeneration. You might have it where you have bone-on-bone degeneration in your knee. It may be the medial or lateral compartment where you've been told there's no choice. You either need to get a partial or a full knee replacement. This can help with that too. What about things like tennis elbow? Like I said, Alta tennis is huge down here in Atlanta, Georgia. So we see a lot of tennis players with that. But low back flare-ups with bursitis, degenerative disc disease, low back problems, hip issues, okay? Hip sockets, all could be helped with stem cell therapy. What about plantar fasciitis? A lot of people are runners, and they all come in with this plantar fasciitis that there's been no help for it. We used to tell them in the old days to just basically roll their foot on a plastic bottle of frozen water. So take that, put it in the freezer, and then roll your foot over it just like this. But now we're able to offer them stem cell therapy where we can inject it laterally right into the side of their foot and help heal up and remove the inflammation in the bottom of their foot. So lots of different things can be helped with stem cell therapy. Now, question. When it comes to disease and a disease timeline, so when a disease starts, some of you might not even know when a disease starts, but you certainly know when it ends. A lot of times it ends when your life expires, or sometimes it ends when you get well, right? But where does the pain start to show up? Most people would think, well, I would know right away. As soon as the disease starts to show up, or the disease crisis or disease syndrome, I should feel pain right about here, right? Well, what about here? Maybe you feel it here. Write down in the comments section where you think you might feel it. How about over here, right? Maybe not. What about here? Well, typically, guys, where you're going to feel it is right about here, towards the end. Pain is always the last thing that shows up. Think about this. My dad had 2 massive heart attacks that flatlined him. Now, he was literally pronounced dead. Now, fortunately, we have, once again, the best emergency, crews and techs and doctors in the world that revived my dad. But when they did the angioplasty on him, they went in and looked at his arteries. They found 5 blocked arteries, all in the upper 90s. 3 of them were the way upper 90s, in fact, almost 100%, and a couple of them were in the middle to lower 90s. But he had that much blockage and never felt it. Disease was starting 30, 40 years earlier, but he didn't feel the symptom till almost the very end, and it almost killed him. Many times you don't find a symptom or even know about a problem until it's what? Until it's too late. So wouldn't it be great if you can find a symptom a little bit earlier? That's when it notifies you before the damage occurs, because by the time it gets to here, the knee is already degenerating. The shoulder is already degenerating. The wrist is already getting a problem. You have frozen shoulder syndrome. You have low back with decay. You might have neuropathy where the nerves in your low back are going down into your foot, and you end up with foot drop or all kinds of other problems. Or maybe your colon is shutting down, or bladder. Or you end up with prostate cancer because the nerves in your low back are so pinched off, they're destroying where those nerves go, the different organs. So a lot of these things can be helped if you even found the problem a little bit sooner. What if you're in something like a car accident? And I get this all the time when patients come in and they're sitting in front of me during their consultation. They'll say, "Oh, Dr. Nick, I can't think of any injuries I've had." Well, what about a car accident? Yeah, not really. I mean, but you know, they weren't that bad. I mean, I didn't fly through the windshield. I mean, I didn't smash my head on the windshield at all, and there was no blood. It was no big deal. But think about this. When you get impacted and your head whips forward and then it comes back, look at the range of motion and the stretch that occurs. All the different ligaments and tendons and capsules that get stretched. The nerves get stretched and irritated. What most people don't realize is there's an equation. The laws of physics have equations, right? I never liked these when I was in school, but the law of physics is this. Force equals mass times acceleration, okay? Force equals m times a. What that means is this. If you have the mass of a 4,000-pound car and it's moving at 40 miles an hour, the force is 160,000 pounds of pressure. Now, you could say, well, but you know what? I'm not the car. I don't weigh 4,000 pounds. Okay, you don't weigh 4,000 pounds. But you might be a lady that weighs 150 pounds, and you're still traveling at 40 miles an hour, and all of a sudden, you stop short. Why? Because you hit an embankment or another car. You still are equaling about 6,000 pounds of pressure. So there's a lot of force there, and you don't realize it's causing a tremendous amount of damage, causing degeneration. I hear people all the time saying, well, you know, Dr. Nick, I had this accident years ago. It wasn't recently, but I feel the pain now. Well, all over that time, that 15, 20, 25, 30 years or so, your spine has been degenerating and deteriorating. The discs have been getting thin, and the bone spurs have been forming. All because you didn't know to do anything about it, because you didn't realize that the problem was in there. So we see this all the time. And then the typical treatment cycle is this. You have your pain, so whether it be your neck pain or shoulder or knee or ankle or low back or hip, whatever it may be, you take your non-steroidal anti-inflammatory drugs, your NSAIDs. Of course, it just gets rid of the pain, but it's not making it better, so the problem is still there, getting worse. Now the knee pain's increased. And I hear that all the time. People say, well, my back pain or my neck pain or my joint pain, whatever it was never this consistent. Now it's consistent all the time. It used to come and go. It was here maybe once a year. Now it's twice a year. Now it's every couple of months. I'm feeling worse and worse. And now it's not going away. It's there all the time. So now the pain is increased. Now you're taking stronger drugs. Now you're not going to the counter anymore. You're getting maybe prescription drugs. You're going to the doctor. The doctor takes some knee x-rays. And he says, you know what? Let's give you some cortisone injections. Well, cortisone, as we're going to talk about in a little while, is not very good. Cortisone is not healthy at all because you can only get it a couple of times, maybe 3, 4 times. Anything more than that, you have severe permanent damage. So you can't get this very often. So what are these drugs doing? You're taking drugs, once again, what we talked about earlier. You're taking drugs thinking it's making the problem better because that's what you've been told, right? You've been told that by the drug companies. You watch it, commercials, and it's amazing to me. People see these commercials all the time, and it has all these different side effects and a whole list, but you see the person jogging on the beach, and it looks like everything is glorious, everything is fine. But meanwhile, it causes rectal bleeding, sudden death, myocardial infarction, you know, all the things you heard about. You know what I'm talking about, and you know you laugh about it too. You watch these commercials thinking, anybody takes these things? I can't believe it. But your doctor's recommending it. And worse yet, what you do is you go to your doctor and tell you, yeah, I saw this commercial. I need this stuff. I need this stuff because I know it'll make me feel better. And it might. But in the long run, you're trading short-term pain relief for long-term destruction because you're never fixing the problem. So the purpose of the drugs is to alleviate the pain, basically change and alter that brain-body connection, that mind-body connection, lowering the pain, causing inflammation to leave the site. So that's really what the drugs are doing. But what the drugs are not telling you, and what they really are doing, they don't address the root cause of the problem, so the problem continues to get worse. These drugs do not heal or regenerate anything, so no tissue is healing. I always find it amazing when somebody thinks they're taking a drug and it's actually healing them. You know, I always say to them, well, give it to a corpse. Cut the arm on a corpse and pack those drugs in and see how well it works. Is that going to heal the arm of the corpse? The answer is no, because there's no life in there. So the drugs don't do any of the healing. They don't regenerate anything, but instead the NSAIDs are linked to heart attacks, ulcers, and kill 15,000 people every single year just because of NSAIDs. They are the #1 cause of acute liver failure. Not to mention they also cause kidney problems. So these NSAIDs, these non-steroidal anti-inflammatory drugs, are bad news and you need to avoid them. Get to the root cause of the problem rather than just treating the symptoms. And like I said before, cortisone's not much better. Cortisone's actually horrible. Cortisone is used to really just break up the scar tissue. It's an anti-inflammatory. Cortisone degrades the bone density in the cartilage. That's why you can't get very many shots of this. You can really only get about 3 or 4 of them because it's permanent damage. It causes permanent damage, permanent degradation to the bone, the cartilage, the joints. So, and it's only temporary. It really doesn't work very long. Now, there are some better alternatives like hyaluronic acid. It's a much better source. It basically comes from rooster cone. So it's very, much more natural to use. It's a natural substance that basically puts lubrication into the joints, kind of like a WD-40. But once again, this is only temporary. Now, you can get more of these because they don't cause as much damage to the knees and the other joints. So you can have this done more often. But once again, it's not regenerating. Think about this. If your tires are wearing out on your car and you're getting balder and balder and balder to where you can't put the penny in there anymore into the treads and see, the measurement, instead it's just getting balder and balder. It's getting more and more dangerous because now you're looking at the threads on the side of the tire and you're also looking at the fact that you have no more treads. So guess what? If you hit water, you're going to hydroplane. You're going to get into an accident, maybe cost your life or someone else's, all because you have no more meat on your tires, no more rubber on your tires. So aligning your car is not going to put more rubber on your tires. More rubber on your tires is the regenerative process. On your car, you've got to change your tires. But in your body, you could take something like stem cells and it actually causes regeneration of the tissue. That is the key thing. Because after you've tried all these and they don't work, you're headed for the surgery. So now you go back to the doctor because your cortisone injections didn't work. You go get an MRI done. They say it's worse now. There's almost bone-on-bone degeneration here. So now you get the surgery done. And here's the problem. When you get the surgery done, first of all, surgery is dangerous because you're getting put under. Anytime you get put under and you're under anesthesia, you don't know if you're going to wake up, to be honest with you. But not only that, surgery can cause infection. There's an enormous amount of recovery time. When you get a knee surgery, I don't know if you realize this, but if you have a knee surgery and they go to cut off part of your femur and cut off part of your tibia, the joint that makes up your knee, they can only do that twice. So in the States, they don't like to do that on anybody younger than 50. Why? Because they know they're going to need to redo it about every 10, 15 years, if it lasts that long. So guess what? That means in 20 years, you're going to need it again and they can't do it anymore. So you're thinking, I'm just going to get knee surgery done, I'm just going to take care of it once and for all. It's not. You're going to need it again and then maybe even again. Then the problem is you can only get it done twice because they can't keep taking more off the leg every time they do this. So the surgeries, look at it, they're just opening your knee. They're cutting it open. So there's infection rates. And once again, the recovery time is really long. It could be months and months. And all the different rehabs, it's painful. Wouldn't it be better if there was a natural alternative or a better alternative? And that's really where stem cell comes in. All right, and that's why this video I think is going to be of great benefit to you. And I hope, my prayer is you get a lot out of it and you get great benefit and then you get the answers to your problems. So stem cells, This is really where it's all going right now. It's all about regenerative medicine. Why don't we regenerate the tissue? Let's regenerate the shoulder. Let's regenerate the hip, the knee, the ankle, the wrist, anywhere. We can put stem cells near the spine and start to regenerate discs. So there's lots of different things. There's so many different applications, and every single day they're finding out more and more things that could be done with stem cells that we don't even realize, because stem cells are basically your body's primitive cells. They're the original cells. When your mom and dad came together, okay, we're not going to get into detail on that, but you know what I mean. When they came together and they formed one cell, and that one cell doubled and kept doubling, 2, 4, and you know, we keep going and going and going, 2, 4, 8, 16, 32, 64, and so on. And we keep doubling and doubling. Those original cells, those primitive cells, are the stem cells. And the great thing about them is they haven't differentiated into anything yet. Dr. Bruce Lipton, very well-known doctor who did stem cell research back in the 60s, saw that you could take stem cells, put it into petri dishes, 3 different petri dishes. And what he did was he put stem cells into one, and he grew muscle. Put it into another one, and he just changed the environment a little bit, and fat cells grew. Changed the environment on the 3rd petri dish, and he was able to grow bone cells. All from the same original cells. And we see this. Why? Because stem cells can multiply into different kinds of cells. Stem cells can become more stem cells. That's the great thing about it. When you get a stem cell therapy or treatment, it continues to benefit because our bodies are making more and more stem cells. Stem cells can make muscle. Stem cells can make heart. They can make skin. They can make tendons. They can regenerate bone and cartilage in someone's knee, and they can make nerve cells. So stem cells are the original cells that then differentiate into all the different cells we have in the body. And that's the beauty of this. They can do virtually anything. They're little miracles ready to go where your body needs it. Now, where do we get stem cells from? They come from lots of different sources. Stem cells come from autologs. And basically, autologs, or autologous, that simply means they're coming from you. You're making your own. Now, they can come from bone marrow, or they can come from fat cells. The only problem with autologous cells is this. They're older. Because you might be older, you're 70 years old, you're 50 years old, you're 45 years old, whatever you may be, you're not a kid anymore, you're not a little spring chicken. So your stem cells don't multiply as quickly as embryonic stem cells, as a baby's stem cells. Their stem cells multiply, multiply, multiply. So if a doctor takes this from your body and tries to make stem cells out of it, they're not as good as the younger stem cells. These kind of stem cells we call allograft, which means they come from another source. Now, what's the other source? There's a couple of different places. Some people can get them from basically cord blood. That's called hematopoietic stem cells. That comes from cord blood. And the other type is mesenchymal stem cells, which comes from the placenta area, and something we call Wharton's jelly. That's coming from the umbilical cord. So the umbilical cord is the other place that we can get these stem cells from. Now, what is the best place? And this is really where it's important that you're making sure you're getting your stem cells from the best source. The best source is Wharton's jelly and placental tissue. Now, Wharton's jelly and placental tissue, we'll get into that in just a moment, but basically the products that we use are ethically sourced from donating birthing tissues such as umbilical cords and placentas from full-term deliveries. I want to stress that because one of the things that people have thought for years is I don't want stem cells because they're coming from aborted fetal tissue. They're not. That's not how this works. And believe me, if they were, I would never use it because I'm completely against it. Now, when it comes from a baby, so we had 4 of our children born at home. All my girls were born at home. So when the baby's born, the mom and the baby are put on the bed, and the baby's with the mom, my wife. And then, after a little while, they take the baby, put the baby aside, and then my wife would sit back on the birthing stool, and she would deliver, okay, a second time. The second time was she's going to deliver now the placenta, the sac, the bag that the baby was in. And they would take the sac as soon as my wife would deliver it again. And sometimes she would say that was as difficult as delivering the baby. When they deliver the sac, the placenta, they would then look at it. They would examine it. The midwives would. and they would look at it and make sure that it was all healthy and all good. And what they did back then was they would bag it up and throw it away. And that was it. And throw away all that goodness because there really wasn't much use for it. Now, what happens is moms donate it. So it comes from donated moms. Now, here's the key. Comprehensive medical and social histories of the donor are obtained and tissues are procured, processed and tested to exceed standards established by the FDA. So once again, we have to make sure that the placenta, the donated placenta, not the baby, but the donated placenta that would have been thrown away years ago anyway, that it's checked, that it's investigated, it's sourced. Make sure that the mom was not on drugs. Make sure that it's a healthy, viable birth. Make sure there's no disease. And make sure 100% those cells are processed minimally so that way they can be beneficial to people who need them. Not only that, the products are intentionally derived from two tissue sources, the Wharton's jelly layer of the umbilical cord as well as the placental tissue. These rich, potent tissue sources are uniquely able to help protect, cushion, and support injured parts of the body as well as aid the optimal regenerative environment. And that's the key. We need those embryonic cells to be able to regenerate the healthiest tissue. And like I said, I'm going to say it again. It is not from the baby. The baby's been delivered safely. This is from the placenta that in the old days, which would have been thrown away anyway. Now, mothers who are healthy and vibrant and who are screened, comprehensive screenings, social and health histories are taken. This is the tissue that's now used to make the stem cells. The amniotic membrane is the barrier that protects the baby from the mom's immune system. Wharton's jelly is the protective layer in the cord that is the richest source of mesenchymal stem cells in the body. Like I said, here's the Wharton's jelly right here. This is the layer that surrounds the umbilical cord and protects it. That is the richest source of all the stem cells of the mesenchymal type in the body, and those are the best to use. Now, as I said, the products we use are of superior quality, and that is something very important you want to make sure of when you are choosing the right doctor. So when you look for a doctor in your area, make sure you're choosing someone who's using this high quality standard of cells. So the company that we use has 4 main products: Corcyte, Amniocyte Plus, Amniocyte, and Polycyte. So these all are used when injected into the injured area of the cells, and the regenerative tissues stimulate, repair, and your body regenerates only what is needed: cartilage, ligament, tendon, muscle, discs, bones, nerves, etc. So wherever the stem cells are injected, the body then uses that to heal the area. Your body has an incredible innate wisdom. It knows where it needs these cells. So it will take these cells and move them right to where it needs it. Now, of course, you need to be able to inject them in a place more accurately. When you can inject it more accurately, you're going to get even better results. There's something else that we do in our office called PRP, which means platelet-rich plasma. This is another type of regenerative medicine, but it's not the same as stem cells. PRP basically means that we take the person's blood. So, for example, someone sitting in our office, our nurse practitioner, takes a blood sample. When she takes a blood sample, she then takes it and spins it in a centrifuge, so that way she separates out the red and white blood cells from the plasma. The plasma is then concentrated. Now that plasma has different modulators of inflammation called cytokines. There's different healing proteins in there, healing factors. That is then taken and we can re-inject that right into someone's joint, into their shoulder, into their knee, into their hip, into their ankle, their wrist, wherever they need it. And that will actually help with the healing process also. Like I said, there's a lot of different healing factors in there. The great thing about it is it's not going to be rejected because it's the person's own blood. But like I said, it's not the same as stem cells. It doesn't have that same regenerative power, but we do use this to assist with the stem cells. And we also use it for patients who just simply have inflammation in their joints, maybe a hurt shoulder or hurt knee that doesn't have a tear, and it doesn't have degeneration. There's no bone spurs or bone degeneration, but they just simply need some healing help in those areas, and we can inject this PRP. So when someone comes into our office, for example, and you will hopefully experience this in someone near you, the procedure is very quick. So where a knee replacement takes months to recover from, and the operation takes hours. When someone comes into our office for regenerative medicine, which is stem cell or PRP, mainly stem cell, it really only takes 15 minutes, 10 minutes, might take 5 minutes, but at the most it might take is about 30. No anesthesia, hospital stays, or antibiotics. I mean, you don't need to be put out, you don't need to be put to sleep or anything like that. You just simply clean the area and we inject where it needs to be injected. Significant clinical improvement function within 1 to 3 months. So you're going to start to see significant improvement right away. Now, it doesn't mean you're going to feel 100% within a day or two. You've got to give the stem cells time to reproduce and keep reproduce and start to form that new tissue at the end of the joints, okay? So it needs time to do that, but the great thing is it can be working up to 3 years. Why? Because the stem cells continue to replicate, they continue to reproduce, and they continue to make more. Minimal adverse effects, maybe a little bit of fever, maybe a little swelling, maybe a little bit of rash or irritation at the injection site. That's about it. Far less than from a knee surgery or a shoulder surgery or a hip surgery. And zero recovery time. I mean, it literally takes nothing. You walk out of here with a little Band-Aid on your arm, and that's about it. So it's very, very simple. Now, what can you expect? Well, at the day of the injection, within about a week later, you can start walking up and down steps. You're going to notice significant improvement at that point. Within about 4 weeks, you're going to feel about 80% better. A lot more activity, activities of daily living are going to improve, and so on. By about 8 weeks later, you're going to be about 95% better, to where you're really doing a lot more things. You're almost noticing no pain anymore. You're enjoying life. You're doing things like you haven't done in many, many years. Now, there's different things that we do here too. One of the things that we do is we also put bracing on someone's knee. So if they're coming in with a knee problem and the bone is sitting like this, and you can see that maybe we call the medial compartment, meaning it's closest to me as opposed to the lateral compartment. The medial compartment is bone on bone. We need to offload that. So we put a brace on the person's leg that levels it out. Once it's leveled out, then you can do the injection. If you do the injection without offloading it, you're going to continue to wear it out. It's almost like saying, hey, my front end is all misaligned on my car. The tires are wearing out. They're going bald on the edges, on the outside edges. You can put new tires on, but guess what? It's going to continue to wear out. Or you can put new tires on and align the front end of the car. And next thing you know, now you've got alignment and the tires are wearing evenly. That's the same thing that happens here. So that's why we can get the results that we get, where we can get a 95% success rate in really only about 8 weeks. Now here's some examples. So we see here, these are the two knees taken in July of 2016. You can see the lateral compartment right here. And what I mean by lateral means the outside part of the knee, whereas this is the middle part of the knee. The outside part is out here. So it's bone-on-bone degeneration there. Stem cells were applied. By April of 2017, you can now see a much larger gap right over here. So the stem cells went into the area that was needed, and like I said earlier, it can rebuild the cartilage, it can rebuild bone, it can rebuild tendons, it can rebuild muscles, it can rebuild nerve. But in this case, it needed to rebuild that cartilage. So once it got the cartilage in the right spot, the knee was offloaded, it was able to heal up beautifully. Another example. You can see here, once again, lateral compartment. Outside part of the knee, bone-on-bone degeneration. After basically just a few months, we started seeing more significant improvement here. A lot more spacing between it. So once again, the stem cells knew exactly where to go because they're intelligent. They know exactly where to go, but at the same time, you have to know how to apply them properly. One thing we do in our office is we use ultrasound to guide the needle. We have to know exactly where to put that. That's one of the big differences. In offices, if they're not using ultrasound to guide the exact position of the needle, your percentage of success is going to go down dramatically. So you have to know exactly where to put it. So our nurse practitioner is looking right at the screen as she's inserting that needle, so that way she can make sure she's getting the stem cells in the exact perfect location. Now, a question I know I'm going to get is, what does this cost? And is this covered by insurance? And I'm sorry to say it is typically not covered by insurance. And the reason is this, is because Medicare guidelines state that a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition, is deemed not medically necessary. So imagine that, okay? That's our healthcare system, which isn't really a healthcare system, it's more of a disease care system, because if it was a healthcare system, it would pay for things like this. So I'm sorry to say that it's not. So now what I want to do is get into the cost of it a little bit so that you know what to look for, once again, when you're finding a doctor in your area. So a knee replacement, national average for that in the United States is roughly $25,000 to $50,000 plus, depending on whether you're getting a partial knee replacement or a full knee replacement. Out of pocket for that, I know people are thinking, well, my insurance will cover it, I'm not worried about it. Your out of pocket is still going to be at least $3,000, maybe upwards of $15,000, depending on your deductible, depending on your plan. Your deductible could be $10,000, so you're going to pay that before you even have your surgery. So, you know, plans are plans. So you want to make sure that, one, you've got a low deductible, but the problem is that many of you might have a low deductible and a high premium. So a lot of you pay a higher deductible to get your premium lower, but then you really can't use it because your deductible might be $10,000. So that's the problem. So basically, what does it cost? What's the national average then for stem cell therapy? Because, by the way, knee replacement still isn't regenerative. It's still replacing your knee and still has to go through all the rehab there. So the national average per cc, okay, now what I mean by that is cubic centimeter. It's the size of the shot. So it's the amount that they're injecting is anywhere from $5,000 to $11,000, depending on the clinic. And I will tell you, I had this brought to my attention just the other day when a man called me from Hawaii. He had a lot of questions. He set up a consultation with me. And like I said, I get calls from around the world, but this one was from Hawaii. And he said, you know, Dr. Nick, I have got questions about my nutrition. We talked about his weight. We brought up his knees because he wrote on his consultation form that he had knee problems. And I said, has anybody recommended stem cell for you? And he said, yeah, there's one person in Hawaii that does it, but I think he's a dermatologist or something. And I said, well, what was that going to cost? And in his case, it was $11,000. And I asked him, I said, $11,000, is that for one knee or is that two? And he said, I'm not sure, but I think it's one knee. And I'm thinking, we're a lot less than that in my office, so you want to make sure you're going to someone who charges you fairly. I will tell you, in my office, for 1 cc, we're at the 5,000 range, okay? So we're on the lower end, which I know some of you may still think that's a lot, but it's a whole lot better and cheaper than a surgery, which may or may not even work. So stem cell, this is the range that you're going to be looking in. So, like I said, in our office, and some of you may choose, and I'm just saying, find a doctor in your area if you can, but if you also want to consult my office, you can give us a call at the end of the video. I'll put my information down. You can always call or email my office, and we're more than happy to get on the phone with you and discuss different options. Maybe you can come out and visit us too. But there's things that you want to look for when you're looking for the right doctor and the right clinic to choose, and that's very simple. One, you want to make sure they're mesenchymal stem cells, so they have to be the highest quality stem cells. The guy that I was just talking about, the gentleman from Hawaii, was telling me that his doctor was going to use his own fat cells to make stem cells. So that's basically the autologous type. Okay, so he's making it from himself. The problem with that is they're not going to be young stem cells. They're going to be older stem cells. They don't reproduce as much. So he's not going to get that maximum amount of stem cells after 3 years of these things reproducing and reproducing and reproducing. It's not going to be as good. So like I said, you can get them from bone marrow or you can get them from fat. This doctor was going to take them from his fat, which was going to save him a bunch of money on the doctor's side, but he was still charging him $11,000, and he's not even getting the best quality stem cells. You want to make sure they're mesenchymal stem cells from the Wharton's jelly area, which is once again right around the umbilical cord, or the placental tissue. And once again, that's called an allograft. An allograft means it's coming from another source, from the placenta that once again was donated or was going to be thrown away. So that's where that's from. Number two, make sure they're sourced from donated birthing tissues and umbilical cords and placentas from healthy full-term deliveries. Okay? You want to make sure that these are hypoimmunogenic. What does that mean? Hypoimmunogenic means that it's not going to cause an immune reaction to you, because these cells are so primitive. So they're not going to give you an immune or allergic type reaction. Your body's not going to reject them because they're the youngest form of cells. So you want to make sure they're from a healthy source, from a mom that was screened and vetted. Make sure that she wasn't on drugs. Make sure that there was no disease So you have to make sure of all these things. A comprehensive medical and social history has to be taken of the mom, and the tissues are processed, procured, and tested to exceed, okay, the source that we use, the company that we work with, exceeds the FDA standards on this. You also want to make sure that the clinic you're going to, the doctor you choose, uses ultrasound-guided injections. That is key. Otherwise, he's just going to... Many times I hear people say it didn't work because all I did was just inject right into the shoulder. They didn't inject it right into the specific place where it was needed, right where the tear was. So you have to make sure you're using ultrasound-guided injections to make sure you put it in the exact same spot to give you those very, very high percentage of results. And the other thing, make sure they're using support bracing to align the joint better and also give you stability to the joint. So these are the things that you want to look for when choosing the right doctor. Now, like I said, please, if you can find a doctor in your area, definitely do something like that. But if you can't, or if you want to come visit us, I see that a lot. Patients will say, no, Dr. Nick, I want to come see you. That's okay too. We will welcome you with open arms, whether you're coming from the United States or around the world. We've had people fly in from all over. So we welcome everybody with open arms, and I'm honored. I have to admit, I'm honored when people can find someone close to them, but they choose to come to see me, and it literally warms my heart. We get pictures with everybody, and it's because I'm just so honored to have that. Anyway, I'll put my information up here. It's also going to be down below in the description box, but I'll put it up here, but you can get it either way. My website, very simple, thetotalhealthsolution.com, thetotalhealthsolution.com, or you can email my office at info@thetotalhealthsolution.com. Now, I will ask you this. Please don't email or call my office and ask us to help find someone in your area because we don't have a database. We don't know who to look up. We wouldn't know how to do that. So please don't call us about that. We tend to get overwhelmed with that, so we can't do that for you. But if you do find someone in the area, like I said, that's great too. If not, you're always welcome to come visit my office. We will welcome you like your family, I can promise you. So anyway, guys, I hope this is great information for you. If so, I hope you like it. Share it, comment, subscribe. Make sure you check out my other videos over here. And guys, either way, I hope you find the answers to your questions. I hope you get out of that chronic pain, because I'll tell you what, it is not fun. You can't live the long, healthy life that you want to live, that God created you to live, when you're in a lot of pain. So I hope that you find the help you need, and it's in a healthful way, it's in an ethical and honest way, and that you get your health restored. So that way you can spend all the time you want with your family and do all the fun things you want to do. Anyway, this is Dr. Nick. God bless. Have a great day. Bye-bye.